So my mom always told me that I had a great face for radio. And it's my great honor today that on a panel today, I get to introduce someone with a great face for TV. I get to introduce the great Richard Louie from CNN MSNBCU News Group. Our first panel of the day, please welcome to the stage Richard Louie, come on up Richard, who will be moderating the conversation about caregiving in America. He will be joined by Nancy LeaMond from AARP, Ken Honeycutt from Samsung Health, Jason Resendez from the National Alliance for Caregiving, Sarita Mohanty from the SCAN Foundation, and Justin Boogaard from GoGoGrandparent. Speaking of Samsung Health, who knew that you could get healthier just by watching TV? So looking forward to this group.
You got all the jokes, Mel.
You got the face.
Yeah, I don't actually.
I need jokes. I need something.
Thank you, Mel. Thank you so much, Mary, as well. And good morning to everybody. Welcome to the National Press Club. Isn't it fantastic to be here? It's one of my homes, and as a journalist, I'm so glad that the press clubs across the country continue to live and are very vibrant. All right. Well, how is everybody doing on the panel?
Great.
Good. Fantastic. Let's start with you, my friend, as we dig into the topic here. And our session is on caregiving in America, trends, challenges, and innovations shaping the future. I got involved in this market, as Mary Furlong and Associates knows, and some of you in the room, as I began to take care of my father about 9-10 years ago. And so I changed my career to work from full-time, which in journalism spaces is 8 days a week, 25 hours a day, to working part-time on weekends. So for the last 8-9 years, I've been flying back to California 2 to 3 times a month to take care of my dad and now my mom, who is living through her journey. And along the way, ended up doing 2 movies, now the third, thanks to AARP and Alzheimer's Association as our launch partners in these endeavors. And so this topic of caregiving in America, to me, is something that I've seen in person and something I care about very deeply. And something that I've seen in families, watching, being the fly on the wall for months and years. And so, as many of you know in this room, it is core to good values of what we care about for the future, for our country, for our communities, and for our families. And Jason, you've done something pretty amazing with AARP. And in this latest study, and it's so important because each and every time you and AARP get together to give us the barometer, basically, where are we in terms of that goalpost, right? There are many numbers out there, but consistently, AARP, along with you and other major organizations, have looked at the standard ways of looking at this marketplace. There's some exciting things that you have to share with us. What would you say stands out? There's obviously the increase in the numbers themselves. We're now up, I would say, what, 25%, 30%? Give us the numbers. Yeah.
Nearly 50%.
50%. Keep on going.
Absolutely. Well, first I got to thank you, Richard, for turning your lived experience into action. This is a marketplace, but it's a community more than anything else. And the numbers show that, and this community needs leaders, folks willing to share their stories and turn that really difficult experience in so many cases into change. So thank you. I just want to give a round of applause to Richard for that amazing work. And also to ask the crowd, by a show of hands, how many folks in this room have been touched by caregiving, either as a caregiver or know someone who has? Wow. Always shocked but never surprised by the answer to that question, because you're not alone. According to our data, and Richard's story helps to bring this to life, all your hands help to bring this to life, there are over 63 million Americans providing ongoing demanding care in this country, according to our landmark research and partnership with AARP Caregiving in the US. And we really see that as the floor, not the ceiling, of folks providing care in this country. And what we've seen over time, as Richard alluded to, we've been doing this research since the 1990s, working to better understand who family caregivers are, what their challenges are, what their joys are, what are the things that we need to put in place in order to address the pain points. And what we've seen over time is that caregiving is, one, becoming more prevalent, as Richard alluded to, a nearly 50% increase in the number of family caregivers in this country. it's becoming more complex, more demanding, and it's lasting for longer, and I'll break that down. In terms of complexity, we're seeing more family caregivers navigating medical and nursing tasks, for example. Nearly 60% of family caregivers report that they are managing complex medical tasks. Think about changing feeding tubes and PICC lines and Googling how to change feeding tubes and PICC lines, because just 22% report they receive any form of training in order to provide that essential care. What we see is when individuals do receive that training, 99% report they have confidence in providing that level of complex care. So there's a huge gap in that role that family caregivers are playing that's increasing the complexity. In terms of duration, more individuals are providing care for longer periods of time. 1 in 3 family caregivers have been providing care for 5 years or longer, which is up from 2020. And these are not hallmarks of the caregiving experience. In fact, they're light that comes through the cracks. Over 50% of family caregivers report a deep sense of purpose that comes from the care that they provide. The challenges that we see have ripple effects. 45% of family caregivers report physical strain because of their caregiving responsibilities. Nearly half experience at least one negative impact due to caregiving, negative financial impact due to caregiving. So taking on debt, taking out high interest rate credit cards and loans. Over 60% report emotional distress because of care. Again, this is not because of the act of caregiving, it's because of the lack of supports we have in place to recognize and value the work of family caregivers. So these pain points and what we see in our data over time that are getting harsher are choices. They're policy choices that we make as a community, as a society. So I'm really excited about being in conversation about some of the ways that we can address these pain points over time and the role that the private sector has to play in driving innovation to meet our shared caregiving crisis and challenge.
Hey, Jason, dive deeper into the numbers and do a little porpoising for us along the way, meaning go low, go high, and just keep on giving us some of the connective tissue between the numbers and what it means at 100,000 feet here. What have you learned in terms of why did we see this number grow? Sometimes it's because we are now opening our eyes and we can actually see that there's the now 63 million. In addition to that, concurrently, it could be the number is actually growing within itself. And what that means opportunistically, and I mean this in a good way, when we look at some of the decisions we can make based on policy as well as in business.
Yeah, absolutely. There's no one driver of the caregiving prevalence spike that we're seeing. It's a number of factors coming together. One, very clear, and the focus of today is the promise of longevity. You know, Americans are living longer. Our data is U.S. data, so I'll talk about it in those contexts, but we see this as a global issue as well. But Americans are living longer, but they're living longer in poorer health. Right, so our lifespans are not matching our health spans. And what that does is requires more from families to step in and help to provide care as people in their lives are living longer, but maybe living longer with a chronic or serious illness or aging into disability. So that's a key factor. 2 are our policy choices, the choices that we're making to support and facilitate home and community-based living. Some of that is good, sort of investing in programs that help people live in their communities, receive care in their communities. The hospital at home program's a great example of that. That has impacts, you know, more responsibilities on the shoulders of family caregivers. We see on the negative side of that, one of the great developments, and I'm sure Nancy will talk a little bit about that with this round, is we released state data for the first time, breaking down caregiving in the U.S. across states. And what we've seen is high prevalence is clustered in places like the American South. And in the American South, particularly states like Mississippi, we see the lowest rates of spending on home and community-based services. So there's more being placed on the shoulders of family caregivers when you don't have home and community-based infrastructure to support, you know, living and receiving care in the home. There's a shortage of direct care workers, for example, and other institutional care options. And so there's more responsibility being placed on the shoulders of family caregivers. So more people are stepping into that role. And then finally, to a point that I think you've really contributed to, is that there's greater awareness. More people are raising their hand and recognizing themselves in the family caregiver role. There's been a culture shift that's happened thanks to storytellers like Richard, to journalists like Richard, to Hollywood studios integrating care into scripts, into the culture. So more people are able to recognize themselves in the caregiving role, and we think that's influencing the data as well.
That's been kind of weird, just on the narrative side, to be honest. If any of you have time, because you have lots of time, Google caregiving movie, and you will see so many results that pop on that, not only because of that unknown actor called Bradley Cooper in his movie, but many others that are out there. You and I were just in New York for CareFest, and there we just saw a rash, and I mean a good rash in a way, I just say, of caregiving movies and interest in the space. This is truly something that's starting to make it into the zeitgeist. Nancy LeaMond, you and I first shook hands, I think 7 or 8 years ago, actually because of a caregiving movie, and you came to the Hill a couple times to celebrate the movie that you kicked off, basically. And it's something that you have seen, this change in the pulse on the ground, something that way back when you said, yes, that's something we need to do. And now fast forward to the new numbers that AARP, through your leadership and Jason's leadership, we have a new goalpost, if you will, a new indicator, and this 50% jump. What does this mean, you believe, all of these things that have been discussed so far?
Well, first off, thanks to Mary. I'd be remiss if I didn't acknowledge Mary was one of the first, her forum was one of the first that actually recognized family caregivers. And I think, as she pointed out, around 10 years ago, she invited me. The one constant, apparently, is I've had the same headshot all these years. So kind of point taken. But how important it was, because there wasn't a lot of attention. And then, Richard, you have done so much to put family caregiving in the public consciousness. And I think we've done, in my world, there's awareness, persuasion, action. We've seen a lot of progress in the awareness area, much better understanding of family caregivers, who they are. The report, Jason went through many of the findings, have been so important in the personal stories, particularly as excuse me, I interact with policymakers. And I'd also like to acknowledge, thanks to the lights, I can barely see faces, but there's so many people in this room who've worked on this for so many years. And the good news is you've moved the ball, and the better news is we have more to do together and with others. I guess what struck me in the report was to pause for a minute and think about the number 63 million. Mm-hmm. And when I thought about it, and we know this is an unpaid job that doesn't discriminate. It's the only job, really, today that probably doesn't have discrimination of any kind. And 63 million is an astounding number. And what it says to me is that family caregivers aren't only mothers, daughters, sons, friends. They are the new provider group, recognized provider group in the healthcare system. And we have to work even harder to have that understood, I think, in the policy arena. The other thing that struck me was a pretty consistent percentage of family caregivers in the workforce. Around 60% of us, are in the workforce full-time or part-time. And I tell folks, I get as many calls today from businesses as I do from individuals asking for resources, and AARP has an employer resource center and others. But I think we've moved from a point where we know it's affecting the economy outside of the family, and we know it's affecting the family economy. Roughly 80% in the survey said that they were paying out of pocket, and I think you know the number, roughly $7,200 a year. So all of this economic impact, I think, is the next wave of our efforts. And you all know, and I think we'll probably talk about it later, that we have bills that we're trying to move in the Congress related to a tax credit for family caregivers, maybe allowing caregivers to use HSA funds. So those were some of the principal things I took from the report. And one thing great about sessions like this is you have the opportunity to learn from others. So I'm going to be finishing my comment.
Oh, well, before you finish your comment, I'm very interested in the programmatic shifts that you've made since we last shook hands, and because of the development of information like this at AARP, that you think has helped businesses, have helped policymakers, and have helped families on the ground. What are one or two of the things that has stood out to you in that arc of the 8 years that's working better now?
Yeah, well, I would say we've had tremendous success at the state level. We've passed around 800 bills, range of subjects, respite care, caregiving tax credit, paid family leave. And the appetite to engage the issue at the state level, whether it's red, blue, or purple, has been very strong. It has not been as strong at the federal level, and that is really the next place. Lance Robertson helped enormously on implementing the RAISE family caregiver strategy. Many recommendations, some have been implemented, others are still on our plate. But in order to move forward, I think we need to press much more on federal legislators. And part of that, I think, is highlighting the community that's present in this room. And that is not just jolly nonprofits like the one I'm part of, but also the business community, the healthcare establishment, the philanthropy community, all together to make the case that we have to support family caregivers. It's not just a personal issue anymore. It is the foundation of our long-term care system in this country. You know, years ago, we worked to pass the Affordable Care Act, and after it was finished, I thought, well, okay, now we're moving on to the next big issue, long-term care in America. And the fact is, we haven't really moved on to it in a systematic way, and now is the time.
Yeah, I was sitting at a long-term care insurance conference in the Midwest. We all like to do that once in a while, don't we? And one of the takeaways here, Nancy, was that they want to get back in. They're trying to figure out what is the right way. What's the beachhead, basically, of trying to re-enter? And that's a good indication. Number one, that they are actually gathering. Number two, that they are talking about this topic in ways that will help America and Americans in this process. And we'll get more into the bipartisan nature or nonpartisan nature of this effort and some of the data points along the way and what that can mean for the future in policy specifically. I know that Nancy was looking your way, Sarita, and she was looking at you for two reasons at the SCAN Foundation. And I was talking about porpoising here. You're not only a clinician and you practice in this space and you understand what your patients want, but also at SCAN, you are looking at solutions in the space and how to create more energy, both in business as well as in nonprofit. Briefly tell us about SCAN, and then tell us what you're hearing from your patients when we look at the new data, because we're really asking, what's the future?
Well, thank you, Richard. And I also do want to call out Mary. I can't see her, but I want to thank her because she was one of the, she's been an inspiration about really thinking about aging as an investment opportunity. So I thank her for that. I'm really a pleasure to be here representing the SCAN Foundation. We are a grant-making and impact investing organization that focuses on older adults, aging in home and community. Our intention is to be bold and equitable in how older adults age and get community supports. We are really focused on lower income older adults from communities of color, as well as those that reside in rural settings. And I think, for me as a physician, I've also been on the payer side and in provider systems. I think, we are just seeing that the same themes, the siloed approach. We seem to be focusing on programs, not on people. You got Medicaid here, you got Medicare there, you got housing supports there, and people are finding it really difficult to stitch all of these programs together. And so, I have an example. I actually do some urgent care as an internal medicine physician, and I saw a patient, Angela, who is a caregiver, and I see this a lot. You in urgent care, you have an older adult comes in, and the caregiver is often kind of sitting on the side, and nobody asks the caregiver, how they're doing. And in Angela's case, she was sitting, you could tell she was exhausted because her mother had Alzheimer's and was coming in for some clinical issues. And, she's 53, has 2 jobs, because I asked her, I said, how are you doing? And she said, and she looked really, really distraught. And she said, I just don't have time to be a patient, so I can't even get care. And you could tell that she was really struggling. So I think there's just those examples about the fragmentation in the healthcare system. And one thing that really concerns us at the SCAN Foundation is the potential, the Medicaid cuts, and through HR1. And Jason, you talked about the kind of foundational elements of home and community-based supports, HCBS, and we are that is an optional benefit. So as Medicaid gets cut, one of the things we're seeing is that we're going to see likely some states cutting the home and community-based service options. These are things like transportation, meal provisions, personal care assistance, et cetera. And so, and imagine what that's going to do to the caregiver who relies on that. If they can't go to adult day centers or adult day health centers, then that puts a lot more focus, attention on the caregiver to have to care for that loved one. So some of the things that we are just doing really briefly is we really are trying to elevate what are the potential impacts of the cuts on home and community-based services, particularly at the state level. One example is we're working with George Washington University, Allison Barkoff, and Mark Cohen on a clearinghouse, a tracker of home and community-based, like what is going to happen as these cuts ensue. What are states going to start to do to pare down those benefits? And and as a provider, going back to my role as a provider, what I'm concerned, as we see that, we're going to have to address the avoidable hospitalizations that are going to start to happen because people are not going to have the home and community support. So they're going to have to rely on going to the emergency department more than ever. So those are some of the things that rise to the top for me and for the SCAN Foundation.
Yeah, that rubber band snapping, and we'll follow up with you on that because you'll be seeing it again when you're in clinic in the ER. Thank you, Sarita, for that. I want to move now to Justin Boogaard from GoGoGrandparent. Justin, first of all, talk about the inspiration behind GoGoGrandparent. I kind of have a sense of what the inspiration is, but describe to us what that inspiration is, and again, reflect on this market, and it seems like we're hitting a hockey stick again.
Yeah, thank you. So like a lot of us, I was inspired by a family member, my grandma. I think that the difference might be that I was broke and had a lot of time on my hands to be able to address her needs. I was her primary caregiver for 3 years. I moved in when she was 82, moved out when she was 85. She's 94 today, and so I think that I'm also lucky because there's this motivation where every few months, got to come up with something new.
Yeah.
GoGo is really a tool being used by my family. GoGo helps older adults with their errands. We process around 500,000 requests a month. We help them with transportation, meal and grocery delivery, medication delivery, and so it's really grown past grandma. But that's how it all started.
As you know, and by the way, to the panelists, please feel free to pipe in. I'm a cable news anchor. I'm used to people butting in. Be nice to each other along the way. I always have to say that. But if you feel like there's something being said and you've got a practical add-in, please do that without me prompting you. So Justin, what did you learn in the 3 years that led to this idea of a new business?
Yeah, I think that the thing I noticed was that over time, older adults, and at 82, grandma was still playing golf, but began to struggle with things that they hadn't struggled with before. I think the most palpable example was when the clocks would change. And at 84, grandma said, hey, could you just deal with this? And that was sort of an aha moment that if that trend continues, a lot of the things that she relies on to take care of her own errands and needs, she won't be able to navigate on her own. We sort of accept that with driving.
Sure.
Older adults will lose their ability to drive, but I think that same is true for navigating complex systems, not even exclusively technology, but just being able to take advantage of social services can get harder. And so I would say that was one of the core insights that led us to believe that really pursuing this would be a good idea.
Did Grandma let you take care of her, number one? Number two, what does she think you're doing now? Does she think you're a little crazy? And number three, you don't seem to fit the stereotype that might be out there on what a caregiver is. The data shows actually that you are part of the caregiving arc, but the stereotype out there is actually quite opposite of who you were as a caregiver back then.
Yeah. So Grandma was the main character in a People magazine interview about 6 months ago. And so
A lot of people want your PR firm right now. By the way. Yeah.
She's the crazy one. GoGo was her idea, and so I think that she's...
It was her idea?
Yeah.
She
yeah.
said, Justin, start GoGoGrandparent.
Well, she said, Justin, well, the specific request was, hey, what is Uber's phone number? I'm going to need a ride to this performance that she wanted to go to that my family member was in.
Yeah.
I said, Grandma, they don't have that. And then she said, well, you need to make that. And I said, that's a good idea. And so that worked out.
Yeah.
And your second question, I'm sorry?
Does she have intellectual property rights?
I'm not going to go into that.
No, I'm just saying that, again, the stereotype of what a caregiver might be in spaces, something like this, sandwich generation guy, you did not fit that stereotype. Data shows that age group represents a large portion of what family caregivers are.
Yeah. And so if you're asking how I feel about that, I think that is probably true. I think one notable thing I want to add to this conversation is that maybe only 20% of the calls that we get are from caregivers. And I think a lot of those calls are coming in when the need is already too advanced to be super helpful. And so I, again, consider myself lucky that I was able to be there as this change was happening for Grandma, and I could kind of see small ways that we can add a lot of help to her life and reduce a lot of burden on the orbit of my family's life. I don't know why that necessarily is true. Anecdotally, we know that a lot of caregivers do call us right after the holidays. And so I imagine some of this is just, it's hard to keep track of the small nuances that people lose as they're navigating their life if you're not actively with them. And as more and more caregivers are living further and further away from their family, then I think that's just going to continue to compound. If someone signs up for GoGo right as they're beginning to feel uncomfortable driving, so maybe that looks like they're driving at night, or they're uncomfortable driving at night or long
Right.
distances, we've been able to show that we can reduce their emergency room utilization by 30% within the next 6 months of them becoming a member. But a lot of the caregivers that call us, the situation has maybe already
Right.
had too much time to develop, and
Level 2, level 3, right, whatever it might be.
yeah,
Yes.
yeah. And so I think that's just something to think about.
Great. All right, thank you, Justin. Ken, at Samsung Health, you're, I know, big competitor here of GoGoGrandparent. You're, right, fisticuffs. But there's an opportunity here to actually coexist, and it's important, actually, when we think about it. Samsung, known for Internet of Things, IoT, this is less of a term, more of a philosophy. Talk about Samsung Health's current view of the market space. You have some data from North America that was just released, again, from AARP and NAC. What's your thought of where the market space is? And then I'm going to dig in a little bit into the tech side.
Yeah, absolutely. I think probably it's best to start with what are we doing?
What are we doing?
Right. So the start of this is Samsung Health is going to build a virtual mall. And think about in your hometown, a developer comes in, clears the lot, drops footers in, pouring concrete and steel construction's going up. And that's about where we're at right now in the construction phase of our virtual mall. And we're going to bring in tenants, digital health tech companies, and other organizations who want to be part of this and be part of this mall. And the unique thing about this is we're not charging any rent to the digital health tech companies. When we open the doors to this virtual mall, we cut the lights on. We want to have consumers come into the mall and go, this is great. There's fantastic products here. There's fantastic services, and we want to keep coming back again and again. So that is what we're building presently. So I will say a little bit of the current state, and I'm going to use my own personal experience around this, is
Sure.
that my father just recently passed of a 7-year journey of dementia. So having gone through this myself, I understand that of the caregiver fatigue and burden associated with it. Upon his passing, I looked at my phone and I had a folder for him, and I had 9 apps that I managed for his health and well-being. There was no connective tissue between those 9 apps. My brain was supposed to be it. And I use the word supposed in air quotes. But when you are in the throes of caregiving, it is a whack-a-mole scenario every day, sometimes every hour. So what we hope to do and what we're going to build is this co-pilot, this ability to provide an additional assistance to be able to pull all these parts and pieces together to provide some insights and interventions and nudges to the caregiver and the care recipient, and ultimately to the care team, the clinician, as well, through a recent acquisition that we made by the name of Xealth, Xealth. So we'll pull all of this together.
I'm also at Startup Health in the Caregiving Moonshot, the Chief Impact Officer there, and I talk with a lot of founders. And the founders who have products, whether they be physical products or whether they be digital products, are looking for a marketplace like this. Where do we go with our wares, basically, so that folks can find us, and at least there's some centricity, and I think Justin might have an input to that. Part of that idea of a marketplace and the products and services that come in, some might be involved in this thing that we've been talking about a lot called AI, and how do we understand that in caregiving? There's obviously from physical solutions and robotics to the idea of apps and assistants and attendants and everything in between. What's the view from where you personally sit, having gone through caregiving for your father? And thank you for that. And I know you don't want to thank you, but I love me, my caregivers. And second of all, from where you sit at Samsung Health.
Yeah, so again, back to the current state, the AI is between my ears. And it's only as good as you are that day in that particular moment. And we want to make this where it is not reactive. We want to be proactive, and we want to be able to understand subtle cues and subtle differences in biometric data and pull this all together and be able to pull together various data coming from devices that are disparate within the ecosystem. And then we throw that together with the electronic medical record information, and then we're able to pull all that together into one very unified experience. That's going to be the future state, right? So I use the analogy, and I'm going to date myself. Think about when you were driving early on in your life, you had a atlas, and then you moved to AAA triptychs, and then you printed out MapQuest directions. Can you imagine now you're at GPS, and this is, you're just listening and you're driving and following the instructions. What we want to do is help create that automatic method of being able to provide you the option of, this is our recommendation to you, caregiver or care recipient, around your health and well-being. So we want to do that exact same thing with health and well-being.
Right. Jason, I want to bring it back to where we're sitting today, the National Press Club in Washington, D.C. And policy was invoked a couple times here. Briefly, what is, if you had to give a primer to us sitting here at this great gathering, what is the state of both state and federal policymakers, if you had to give me that 60 seconds? Like, this is the state of discussion and policy.
With a 4-letter word or without a 4-letter word?
As many letters as you'd like.
Chaos. It's absolute chaos right now. And part of that, really speaks to the kind of fundamental instability that we see around the social safety net that makes care less hard, right? Medicaid, home and community-based services are the foundation for long-term care in this country and are the foundation for catching family caregivers from falling through the cracks. And so we are extremely worried about, as Sarita mentioned, the impact, the ripple effects of those cuts over the coming years. I think at the same time, we're hopeful that folks, and we've been meeting with CMS leadership, that there is genuine interest in ensuring that family caregivers, eligible family caregivers, don't experience the unintended consequences of Medicaid cuts and Medicaid restructuring. So I think that is extremely worrisome. At the same time, as Nancy alluded to, states are figuring out that no one's coming to save us from a federal perspective and are innovating at the state level. We've seen that clearly in our data on things like more states post-pandemic as a result of the pandemic introduced consumer-directed programs and strengthened consumer-directed programs so that family caregivers could receive payment as part of their care journey. Which is just one example of states innovating in support of family caregivers. We've seen both blue states and red states pass caregiver policies like caregiver tax credits in places like Nebraska. 13 states in the District of Columbia have paid family and medical leave, and we've seen the corresponding impact in our data. Right? While there are so many challenges that we see in the data, we see that more family caregivers have access to paid family and medical leave today than ever before.
How did this happen in these states? Who did it? Did it just with like a magic wand, or what happened?
I think it's a growing movement of folks who believe in the importance of helping family caregivers balance care and work. AARP is a great example of that leadership. State advocates, right? This is, at the end of the day, it's a marketplace, but it's a community of folks who are experiencing the challenges of care, of needing to put food on the table and working. So we've seen tremendous grassroots momentum around policies like paid family and medical leave. And what I think is really beautiful at the state level and what we want to see at the federal level is the really broad-based coalition of advocates within aging, like AARP state offices, to serious illness groups, to child care groups coming together to say there are policies that can support folks providing care across a continuum of care. Right? We talk about 63 million individuals providing care for an older adult, someone with a serious illness or disability, but when you widen that aperture to include folks providing care for children, that number balloons to over 130 million Americans engaged in some form of care across a care continuum. And there's a greater recognition of that cross-connectivity, and as a result, we're seeing efforts and wins at the policy level around things like paid family and medical leave.
Nancy, build on that. Washington State is one state to watch. I've worked with your state offices a lot over the last bunch of years, and there's also grassroots. We were talking about it last night over dinner about Ohio and Pennsylvania also being, we talk about a grassroots in terms of caregiving families and businesses starting up. What's kind of the model that you see that has been working? As you know, Speaker Pelosi as well as Leader McConnell stood side by side supporting some of the initiatives that we've done together, and that all within itself is a surprise to many. It was related to caregiving. What's the model you're seeing going forward?
Well, what you just pointed out has been important, which is the bipartisanship, particularly among leaders, and them telling their own stories. I would say at the state level, we started this about, 15 years ago. It was a little bit lonely out there at the time. And it was mostly aging advocates.
Yeah.
And since then, we've been able to grow support in some places, surprising places, Nebraska, Oklahoma, et cetera, really with help from the business community. And also, but not quite as much yet. So I'm hopeful as a result of this to see the entrepreneurial community engaging much more in these efforts along the way. We were very struck when we started our efforts. We started with a model bill called the CARE Act, which was a fairly simple concept. If you go into a hospital, the hospital should identify the caregiver, and when you leave, the caregiver and the patient should get instructions. And when we started, somebody in our office said, do you think we can actually activate caregivers? They're so busy, there's no real, there's not an association of family caregivers that you can just call. And we were stunned, and we did a call for stories. Somebody said, and I am a caregiver, send us your story, and we thought we'd get 100, 200. I think we got 38,000 within a few days, and we thought, okay, we can do this. And so we built it around the CARE Act, and from that, as I said, every state has enacted legislation. What that tells me is
Yes.
people close to the issue are going to act. The challenge right now is the federal level. We're going to work in the administration. You'll have the opportunity to see people from CMS. Sarita mentions Medicaid. Right now, we're working on the unglamorous world of regulations related to how you define a family caregiver for purposes of work requirements in SNAP and Medicaid. And so it's things like that that we'll be spending time on. We have to push and get legislation so that we can, in effect, codify this view that family caregivers are providers. They are part of the healthcare system, and frankly, the home is the new healthcare setting. And we haven't moved to that point, particularly at the federal level.
Can I
Thanks
add
for your time.
a hot take on that? Because you pointed out Ohio, Pennsylvania, and Washington. And so my hot take is that it seems as if in those states where a central department is responsible for both funding Medicaid healthcare as well as the Department for Aging, they see the ROI trade-off where an investment in social services or in taking care of caregivers reduces the downstream costs. Pennsylvania, I think, is an exception. I think they just have a lot of lottery money, and it's a well-funded department. But I
Pennsylvanians, do you agree with that?
So to Nancy's point, I think that this could make a lot of sense if you're able to bring the caregiving equation into the department that's responsible for the costs of that care. So I think it's a really smart approach. You might see more innovation around this because the investment in a caregiving solution or in social services pays for itself when it comes to thinking about downstream expenses. But there's only a few states that are structured that way. Most others have their Department of Aging kind of looped into their Department of Social Services.
I know Sarita once again on this. Sarita, whatever your comment, please do bring it. But in addition to that, because of your experience in integrated care, that the importance of integrated care systems also leaning in on this and saying, hey, let's look at this.
Yeah, well, first of all, I really appreciated your comment because one of the things, I think the theme we've heard is that there are such tremendous opportunities at the state level. And there's innovation. Jason has brought it up. Nancy's brought it up. You talk about this. One of the things I want to elevate is the multi-sector plans for aging. I can give California as an example because we do a lot of work in California. They call it the Master Plan for Aging. And it is exactly what you described in terms of this intersection between the California Department of Aging and the Department of Healthcare Services that runs Medi-Cal, which is California's Medicaid. And it's really about like how do we think about aging and like the dual eligibles and Medicaid and the home and community-based services and a lot of work. Actually, caregiving is actually defined as one of the core goals of the Master Plan for Aging in California, and so you see a lot of intention around workforce, around respite care, et cetera. These things are being elevated because of these plans, which are basically like blueprints for different states. And we've been actually working with other philanthropies to try to see how every state in the United States can have an MPA, a multi-sector plan for aging. So that's one thing. I think the other thing, when I think about integrated care models, and I talked about the siloed approach.
Yeah.
The one thing I think we've also heard a lot of theme is we have to listen to the people, the end users, the families, the caregivers, the older adults, and one of the things I think I really appreciated your this how you were able to galvanize and hear the voices of caregivers and recognize an opportunity. I think we have to continue to do that, not only for policy, informing policy, but also for the private sector too, as you're designing your solutions, and innovations in tech. You can't design something if people are not going to use it, right? So one of the things we're doing, I'll just say two things. One is our foundation helped launch with the Public Policy Lab a platform called The People Say, and we've curated stories. And I encourage you to go on and offer feedback to us on that, as we have over 100 people on that platform from different states, over 10 states now, that so blue, purple, red, that really talk about their experiences in care, in access. So that is one thing that I think, and I would love to see this at the provider level more and more intention around listening. The other thing is the local nature of health is so critically important. In California, with 2 other philanthropies, we have funded local, what we call eco groups. And what they're doing, and one example, there's one in Los Angeles where their goal was to find out what their older adults needed in their local community. And this was predominantly an African-American community in South Los Angeles. And they found that they needed community support. A lot of the women, people in their community were women who were living, older women living alone in apartments, and they had nobody to support them. And so the community came together and created an elder bill of rights within that community, saying we have a responsibility to help our older adults. And these are just examples, but I think we're gonna have to rely on community solutions, because like you said, Nancy, people want to and will have to be able to live in home and communities. So that's the piece that we would like, as a provider now too, that's what we need to see more of. Yeah.
We, the caregivers and care recipients of said state, right, can quickly talk about what you're doing in Florida, talking about going local and on state side, city side, how you're drilling down in your pilot in Florida.
Yeah, so we launched last November the Samsung Health House, and this was in partnership with AARP and the Age Tech Collaborative. It is located in the Villages, Florida. Many of you are probably very familiar with it, but for those of you who are not, it's the world's largest 55-plus active adult community. 165,000 residents live there. We put 12 Age Tech Collaborative portfolio companies in there. We had just shy of 300 tours of the home since, I'd say, mid-January. And ultimately, what we're doing is we're evaluating the products and services that come through, and we're getting responses back from those who tour the home to say which of those are you going to be most interested in, which are you willing to pay, and what would you be willing to pay. So we're providing that information back to those companies to be able to triangulate based upon that. This is the first of at least 3 homes that we're working on. The next one is in a community called Lake Nona, which is just south of Orlando. We're using that more as the caregiver persona and using locality of Lake Nona to the Villages, which is just slightly north of Orlando, to create the storyline. And then in Q1, we'll launch Margaritaville and Panama City Beach. Later, we will likely move to the west with locations of pilots as well.
Thumbs up. As we reach the end of our conversation here, I wanted to look to the future on innovations, which is really the bedrock of these gatherings that Mary brings us to. And thanks again, Mary, for staying true to that and bring your energy. And what does the next 2 years, 3 years look to you? What brings you hope and concrete hope, actually? For me, I'm just becoming involved with something called Care Genome. As a principal, we're looking at the data stories between caregivers and care recipients. What actually happens? What's the strength levels? What are the gait levels? How do we interact with each other in this care construct? The last 3 feet that we're talking about, that gives me hope, because the market, I believe, is ready for that. Jason, what gives you hope in the next 2-3 years?
What gives me hope is the incredible resilience of family caregivers. Despite all of the challenges, how those challenges have grown over time, we see what remains stable is that sense of purpose that family caregivers find in their care. And that speaks to resiliency, an extreme resiliency that I think caregivers are going to need now more than ever. The same time, though, what excites me and gives me hope are the conversations like these that recognize that caregivers can't live on purpose alone, that they need solutions, they need folks coming from all parts of society to the table with recognition and investments to make their care a little less hard and more sustainable.
Thank you. And Justin, 30 seconds to you. What brings you hope in the next 2 to 3 years?
Yeah, since COVID, the federal government began to invest a ton of resources into understanding why that disease in particular seemed to sniper older adults. I've been really excited by some of the work that's coming out of NIH and the Department of Health and Human Services to create indicating statuses around aging, such that we can develop better therapies and fund those therapies to improve biomarkers that could be predictive signs of someone's functional ability. And I think that it's going to be a really exciting space to watch.
Ken?
We talked about AI, and mine are going to be technology-based. I believe that we will see personalized digital health tech, along with RPM and telehealth. We see smart home and Internet of Things products that will be in the home to be able to support living in place longer. And then I think we'll see more and more of the voice assistant becoming more engaged on appointment reminders, medication reminders, counterindications, and other health-related items as well.
Samsung robots?
We do have a robot in development called Ball-E, but it will
What's
not-
it called?
Ball-E.
Ball-E.
It's in shape of a ball and very much monikered after the Wall-E robot
I
movie.
was just thinking that. That's right. I can totally see the marketing opportunities in that one. Sarita, marketing opportunities. What's your next 2-3 years that you're hopeful for?
Yeah, well, I think really, well, first of all, just the excitement and the intention in this room. Public-private partnerships, I think we need to continue to foster those. I'm also really excited about the state-level innovations that we discussed. I think, one thing we're working on is long-term care reform, and, Washington State is a great example of, what they're doing around long-term care through their payroll tax, so we'd really love to see more of that. I think the last thing I'll just say is I'm really, really excited and hopeful for is we need to continue to engage people and curate stories. That is going to get to the hearts and minds of the policymakers, and I think we're seeing more and more of that, and so I'm really thrilled and excited about the next few years and the opportunity.
Yeah, Nancy, as everybody has said here, the muscle sets being developed locally, that really is what we had hoped for. I mean, that's the glass half full. That's really something that to be proud about. Not only in the recent time, but in the future. What are you looking at in the next 2-3 years?
Well, I agree with everything everybody said, which is that, when we first started, that muscle was pretty underdeveloped.
Yeah, that's right, a little flabby, yeah.
At the I used to say, we'd come together, bring the coalition together, it'd be like a small group of groupies going to a rock band renewal. But now we have a much broader coalition, evidenced in this room, evidenced by all the activity and the private sector, the public sector, frankly, the kind of attention that documentaries have brought to it, stories have brought to it. It's a tough slog. I will say it is a tough slog, and but I think with the combined energy, we're going to make some real progress. And some of it is I'm a big baseball fan, but I don't want to get into your World Series bet. But what I've told our folks is we may be in an era of small ball and not home run ball, and we have to be very, very comfortable with that, because at the end of the day, you can still score some runs. That's the end of it.
So well said, Nancy. All right, and thank you to all of our panelists talking about working together. Appreciate it.
Thank you, Mary.